Hi, my name is Matt, and in this video, we are going to help you get dialed in to take an arm care exam. We'll cover the equipment you need, discuss the different types of exams, and how often you should take them, along with detailed instructions for the range of motion and strength test. Watch the whole thing before you get started, and if you need a refresher later on, you'll find shorter videos in the app. To take an exam, you will need an arm care strength sensor along with the attachment straps. You can connect to any arm care sensor if you have access to one through your organization or a teammate. In addition to testing with your team or at a facility, we recommend that you purchase your own arm care sensor and training equipment, as you will be able to monitor your arm strength, range of motion, anywhere, anytime, and train all year round. You can purchase everything you need at armcare.com. Before we jump into the test instructions, we need to cover a very important topic: arm soreness and pain. It's not uncommon for players to have shoulder and elbow soreness throughout the year. However, this should not last more than 48 hours. If an athlete has pain for more than 48 hours and does not reduce with a proper warm-up, you are likely dealing with an injury and not just post-throwing soreness. If you are experiencing arm pain that lasts longer than 48 hours, we recommend that you visit a licensed medical professional for an evaluation. Additionally, if you experience pain during any one of the tests, please stop. Wait 24 hours and then retest. If the test is still painful, then at that point we recommend that you visit a licensed medical professional for an evaluation. Now on the app, select the exam and you'll see 3 buttons that say Fresh Exam, Post Exam, and Arm Primer. These are the 3 exams offered in the app, and there's a time and a place for each one. The fresh and post exams take less than 5 minutes, and the arm primer takes less than 1 minute to complete. The app will prompt you to pair the active force sensor to your phone during the testing process, so you don't need to search for it like a Bluetooth speaker or your headphones. The app will ask you this during the exam. Now, one quick note here: make sure you have given the Arm Care app permission to use your Bluetooth on your phone. If you're unable to pair your active force, go to your phone settings and select Arm Care app and then enable Bluetooth. The fresh exam should be taken at least once a week. You should consider the fresh exam mandatory because it identifies strength deficits and imbalances, which can lead to arm injuries and poor performance. The fresh exam is done when you're in a fresh state, which means you feel recovered. You want to make sure you did not do any heavy upper body lifting within the prior 24 hours or had a heavy outing or heavy throwing session the day prior. The fresh exam should be taken prior to throwing, but after you complete a proper warm-up. And for pitchers, you will typically do your fresh exam on the bullpen day. Again, prior to any throwing, but after the warm-up. For position players, choose a day of the week, like a Monday, and test on that day throughout the year. The post-exam should be taken immediately after pitching, bullpen, or heavy throwing session like a velo day. Ideally, the post-exam is taken within 30 minutes of your last throw, so you don't have to warm up again. The post-exam features the same test as the fresh exam and should take about 5 minutes to complete. The post-exam provides data for the fatigue key metric. When players don't retain at least 90% of their fresh exam strength, it means they're throwing in a fatigued state and need to reduce the training load in their next outing. The arm primer is an optional exam that can be completed daily following your arm activation routine. It provides insights on arm readiness and also helps to maximally activate your arm prior to throwing. The Arm Care app even allows you to complete the arm primer if you don't have an active force strength sensor available. You won't receive the data, but pressing isometrically as hard as you can will prepare your arm for high velocity throwing. The arm primer with the active force will give you an arm readiness score, which you and your coaches can use to fine-tune your workload that day. When you're strong, you can up the intensity, but when you're weak, you can back it off a bit. It is very important to attach the Arm Care strength sensor to your wrist properly. The wrist strap should feel snug at the wrist and positioned right below the wrist joint. Make sure the power button is pointing towards your fingers. If this is your personal Arm Care sensor, there is no need to open and close the wrist strap. Set it up once where it fits snug on your wrist and then simply wedge your hand through the opening just like putting on a wristband. You do not need to remove the wrist strap when performing the grip test. Just orient the arm care sensor with the buttons down toward the hand, stick your thumb through the wrist strap, and place your index and middle finger along the long side of the testing plate. The arm care app will walk you through every step of the exam. There will be audio and visual prompts to make it easy to follow along, as well as video tutorials if you need a quick refresher on a specific test. An important reminder, if you are taking the fresh exam or the arm primer, you should complete the shoulder activation warm-up provided in the app prior to beginning the exam. Fresh and post exams begin with 3 range of motion tests that look at shoulder internal rotation, external rotation, and flexion. Monitoring changes in range of motion are incredibly important, as research has shown that even a small loss or gain can increase injury risk. When testing range of motion, it is important to understand that it is not a competition, so don't try to compensate to create more movement. Simply move your arm to the point that it feels like you're at your in range without changing your posture. We also encourage players to close their eyes during the exam, as this will help reduce movement compensations. For the active internal range of motion test, the arm care sensor should be placed on the underside of the wrist with the power button facing the fingers. The app will prompt you to turn on and pair the device. Once your phone is paired with the arm care sensor, find a wall and get into the testing position with a half kneeling position, with the opposite knee up relative to the arm that is being tested. The back foot toes should be pressing slightly into the ground for stability and support. The knees and feet should be aligned with the hips. The arm is at shoulder height with a 90-degree angle at the armpit. The elbow should be touching the wall with the forearm parallel to the ground. The hand should be open with the fingers extended, and the wrist should be in a neutral position. Once you are in this calibration position, select the button that says Start Test. The app will calibrate and beep twice when it is ready for you to begin the test. Close your eyes and internally rotate your shoulder forward while keeping your elbow in the same spot on the wall. Stop when you hit your first endpoint and tap anywhere on the screen to record the test. Here are the common mistakes for internal rotation range of motion. The first mistake is putting the same side knee up when getting in the half kneeling position. It should be the opposite knee up relative to the arm that is testing. The next common mistake is not getting the arm up to shoulder height where there is a 90-degree angle at the armpit. And the next common mistake is dropping the elbow during the test. The most common mistake is dumping the shoulder forward when trying to increase range of motion. This causes the user to go past their first endpoint, and then the shoulder starts dumping forward to get a little more range of motion. The external rotation range of motion test is very similar to the internal rotation test. However, the user will rotate their arm backward rather than forward. So get into the same calibration position, click Start Test, and then the app will calibrate and beep twice when it is ready for you to begin the test. Close your eyes and externally rotate the shoulder backward while keeping your elbow in the same spot on the wall. Stop when you hit the first endpoint and tap anywhere on the screen to record the test. Common mistakes for the external rotation range of motion. The first common mistake is looking at your hand during the test. The next common mistake is arching at the low back in an attempt to create more range of motion. The shoulder flexion range of motion. The calibration position for the shoulder flexion range of motion is a little different than the other tests. You will move closer to the wall so that your testing shoulder is touching. Extend your elbow and rotate your hand so that the thumb is pointing up. Your palm should be facing sideways away from the wall, and your hand should be open with the fingers extended. Move your arm up to shoulder height, and when your arm is parallel to the ground, you are in the calibration position. Click Start Test, and the app will calibrate and beep twice when it is ready for you to begin the test. Close your eyes and raise your arm overhead while keeping your elbow straight. Stop when you hit your first endpoint and tap anywhere on the screen to record the test. Here are the common mistakes for the shoulder flexion range of motion assessment. The first common mistake is the palm down hand position. Your thumb should be pointing up and your palm should be facing sideways away from the wall. Now, the most common mistake is arching your back in an attempt to create more range of motion. You need to maintain proper posture throughout the test while keeping your abs tight and the rib cage pulled down. Following the range of motion test, you will begin the strength portion of the exam. These tests include internal rotation strength, external rotation strength, scaption, and grip strength. The importance of strength for throwing athletes cannot be overstated. Strength deficits and imbalances are one of the leading causes of arm injury and poor performance. Prior to beginning the strength test, the app will ask you to calibrate the strength sensor to 0 pounds. When calibrating, make sure not to press down on anything, as this will produce inaccurate readings. The test will begin with a 3, 2, 1 countdown, then close your eyes and press into the wall as hard and as fast as you can. Give everything you've got and don't stop until you hear the double beeps, which indicate that the test is over. Keep your eyes closed while pushing into the wall, as this will reduce compensations. You will complete 2 reps for each test with a 10-second rest period between each rep. If there is too much variation between the scores, the app will automatically add a 3rd rep. Now, if you feel like it was a bad test for some reason, you can hit the repeat test button for a do-over. If you feel like you're sliding on the ground, have someone press down just below your knees to hold you in place. Now let's jump into the first strength test. That's the shoulder internal rotation exam. For the internal rotation strength test, the arm care sensor should be placed on the underside of the wrist with the power button facing the fingers. This is the same position as the range of motion test. You will need to find a doorway, the corner of a wall, a plyo box, or another stable surface to press into. Now lie on your back and place the corner of the wall into your armpit, creating a 90-degree angle. This will create a consistent position that you can repeat for future tests. Your legs should be outstretched on the ground, and do not bend your knees or cross your legs. Place the hip and core band or a towel rolled up underneath the elbow to ensure that there's a great alignment between the elbow and the shoulder. Now the forearm should be vertical on the wall and your hands should be tightly wrapped in a fist. Your head should be on the ground in a neutral position during testing, and do not lift your head up. Now once you're in the starting position, select Start Test, and then the app will count down 3, 2, 1, go. Close your eyes and press forward and hard as fast as you can. Keep pressing until you hear 2 beeps, which indicate that the test is over. Then there will be a 10-second rest period and you'll repeat the test. Again, if you feel like you're sliding on the ground, have someone press down just below the knees to hold you in place. Here are the common mistakes for the internal rotation strength test. The first common mistake is not getting the arm to the correct 90-90 position. This happens if the corner of the wall is not into the armpit. Now the next common mistake is the hand in an open position with the fingers extended. During all of the strength tests, the hand should be in a fist. The next common mistake is the legs bent. The legs should remain straight and flat on the ground. The next common mistake is not using a hip and core band or a towel to prop the elbow up so that it is parallel to the ground. And the last common mistake is lifting the head off the ground during the test. For the external rotation strength test, rotate the arm care sensor so it is on the back side of the wrist. Maneuver your body so that the top of your shoulder is in contact with the wall, and your legs should be outstretched on the ground. Do not bend your knees or cross your legs. Place the hip and core band or a towel rolled under the elbow and position the forearm so that it is vertical. Again, your hands should be in a fist and keep your head on the ground. Once you're in the starting position, select Start Test and the app will count down 3, 2, 1, go. Close your eyes and press into the wall hard and as fast as you can. Here are the common mistakes for the external rotation strength test. In addition to the common mistakes pointed out in the previous test, the most common mistakes in the external rotation test is not contacting the top of the shoulder with the wall. This changes the angle and will affect the testing results. For the Scaption strength test, remain in the same position as the external rotation test. You are simply going to extend the elbow and position the arm at a 45-degree angle. The arm care sensor should stay on the back side of the wrist. Keep your legs outstretched on the ground and do not bend your knees or cross your legs. Again, your hands should be in a fist and keep your head on the ground during the test. Once you're in the testing position, start test. The app will count down 3, 2, 1, go. Close your eyes and press into the wall hard and as fast as you can. Here are the common mistakes for the Scaption strength test. In addition to the common mistakes pointed out into the previous test, the most common mistake is positioning the arm too high or too low. The arm should be positioned at a 45-degree angle. Grip strength testing involves a 3-finger grip, and this is to activate the FDS. It's a small muscle that overlays the ulnar collateral ligament that contributes most to its stability. For the grip strength test, remove the arm care sensor from your wrist and place your index and middle fingers on the gray testing plate with your thumb positioned on the opposite side within the wrist strap. This is similar to how you would grip a baseball. The power button on top of the sensor should be between the fingers and your thumb near the palm of your hand. The body position for grip strength is very similar to the range of motion testing, where you are in a half kneeling position with the opposite knee up relative to the arm that's being tested. Get your testing arm in a 90-90 position. We do this so that all of the muscles around it can't contribute to the force. We're going to get an isolated strength test for grip strength. Now, keep the wrist in a neutral position throughout the test. Once you're in the testing position, select Start Test. The app will count down 3, 2, 1, go. Close your eyes and squeeze hard and fast between the thumb and the fingers. Finally, the arm primer exam is our daily exam that tests the player's ability to produce force at ball release. It is a multi-joint exam that will challenge every link in the kinetic chain. The arm primer takes less than 1 minute to complete and helps to maximally activate the arm prior to throwing. After completing the arm primer, the app will generate an arm readiness summary. Using this data, a player can determine if today is the day to go all out or if they should take a step back. There are 2 tests in the arm primer: Excel, which tests the player's acceleration strength at ball release, and Decel, which tests the player's ability to slow down the arm immediately following ball release. Here's a pro tip. Use the hip and core band as a pad under your knee if you're on a hard surface. For the Excel strength test, the arm care sensor should be placed on the underside of the wrist with the power button facing the fingers. Position your body in a half kneeling position with the opposite knee up of the arm that is being tested. The back foot should have the toes pressing slightly into the ground for support. The knees and feet should be aligned with the hips. The arms should be outstretched to the player's normal release point with a fixed surface being aligned with the armpit. For sidearmers or submarine pitchers, the arm slot will be lower. Again, the hands should be in a tight fist. Once you're in this testing position, select Start Test, and the app will count down 3, 2, 1, go. Close your eyes and press your arm forward hard and as fast as you can. Here are the common mistakes for the internal rotation strength test. The most common mistake is where the athlete moves forward during the test and is using momentum to generate force. We want to ensure that the body is neutral when performing the test. For the decel strength test, rotate the arm care sensor on the back side of the wrist and maneuver your body so that it will be pressing backward into the wall with the arm outstretched at the release point. Get into the same half kneeling position with your toes pressing lightly into the ground to create stability and support. Once you're in the testing position, select Start Test, and the app will count down 3, 2, 1, go. Close your eyes and press backward into the wall as hard and as fast as you can.